Hello and good evening. I'm Melisa Idris.
I'm Sharaad, Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Tonight on the show, we're going to be looking at Vietnam's response to COVID-19, which has been touted by many as a success story. Vietnam shares a long border with China, which made it one of the first countries to have a confirmed COVID-19 case outside of China. However, so far, Vietnam has recorded only just over 300 cases and 0 deaths in a country of nearly 100 million people. Now, nearly a month has passed since its last community transmission, and the country has already started to open up. So joining us on the line to discuss Vietnam's approach to the pandemic is Dr. Huong Le, Senior Analyst at the Australian Strategic Policy Institute based in Canberra, Australia. Good evening. Welcome to the show, Dr. Le. Now,
thank you for having me.
A lot has been said about Vietnam's success in dealing with the pandemic, but I think we should probably begin by looking at the reliability of the data. Now, the government's data was so strikingly low that there are inevitable questions about whether it's accurate. Are there reasons to doubt it?
I haven't been conducting the research and data, so I can't say for sure. Obviously, there are some possibility that there are some cases that are not recognized or not detected. There's no way we can be sure 100% of data, but I don't think there is any reason to be doubting this data. These data are not only from the Vietnamese government; they are confirmed by Johns Hopkins hospitals, by international institutions, by epidemiologists and other Western and international and global institutions, medical institutions. So I don't think there is any reason to doubt those data. There is no, Vietnamese government has not been concealed. It has been very transparent from day one and very rigorous. So I think the probability that the data are missing or concealed are pretty low.
Dr. Le, I mean, many countries around the world are trying to control the narrative on the pandemic within their own borders. And I wonder to what extent this is true of Vietnam. You mentioned, the many institutions that Vietnam, the government at least, is engaging with. Could you give us a sense of what kind of commitments Vietnam has made to international multilateral organizations that have enabled or actually promoted this kind of openness with regard to the situation on the ground?
Well, I don't think it is really to put this pandemic and reaction into the perspective of politicizing or changing the narrative is the wrong way to approach it. I think some countries have adopted that strategy, but I think they have a lot of political agenda to achieve. And that's not the way we should be looking at any pandemic response. Unfortunately, like you said, there are cases happening with the way the narratives are being presented, but I don't think it is a case for Vietnam. Vietnam recognized that the COVID-19 virus was a very serious one from very early on when it was in Wuhan only, and it started to prepare for it to come to Vietnam because as from previous experiences, like with SARS in 2003 and swine flu, bird flus, all around, those things travel. They don't know borders, and it's a matter of time that they come. And Vietnam, being in the region and experienced the previous outbreaks, had been ready for containing and responding to the virus rather than focusing on the political narrative.
Okay, so you're saying that Vietnam's, Vietnam learned its lessons from the previous SARS epidemic. Could you talk to us a little bit about how its public health response has been, particularly in terms of, whether Vietnam has invested quite a fair bit in its public health?
Well, investment in public health, like in many countries, and particularly in Southeast Asia, are still lagging behind. Obviously, Vietnam, in comparison to more developed countries and developed neighbors like Singapore or Taiwan, is still lagging behind. But I think it's about utilizing the resources well and coordinating well. So the pandemic is a crisis, and in any crisis, the best response is to react early, and that's what Vietnam did. And it also is very effective with pandemic with virus, because the earlier you respond, the fewer cases there are, and therefore it is more feasible to control and contain the spread. And that's what Vietnam did. So like you mentioned, it was trained from the previous outbreaks, and also not only with the pandemics and epidemics before. I think that countries in the region, because they often experience natural disasters and crisis responses, they are more used to quick response, coordination, and any emergency response. The key is to quickly react rather than debating which way, because then you lose the golden window of time where the response is most effective. So that's what Vietnam did. It contained the cases. It isolated people who had been either confirmed or came into contact with the confirmed cases very early on. It was very rigorous in testing, and also was able to invent own testing kits. So it was very fast in testing a large scale of people. It didn't have to rely on other labs or international help in this regard, and it developed many additional laboratories that it could conduct testing regularly and on a larger scale. So it was quick response, it was coordinated response, it was building capacity to test and isolate and contact tracing all the cases.
Dr. Tu, one of the ways in which people are comparing different contexts, the state of Kerala in India is one example. Vietnam is now becoming an example, New Zealand. The question really is, on what has public policy pivoted? What are the strengths that each of these contexts have? A devolved system in Kerala, but in Vietnam, it's often said that its highly developed network of surveillance has been a key component in the success story. Would you agree to that?
I don't necessarily agree with that, because Vietnam actually, in the earliest stage, the success of containing the spread was not based on surveillance and not on the contact tracing using technology, like, for example, in Taiwan or Singapore, where the act that did the contact tracing was very early on engaged. I think Vietnam, the first reaction was to isolate the cases, isolate the people coming from travels, first from China, but then later on also from Europe, the cases, and just isolate whether the tests were positive or negative. It was mandatory 14 days of quarantine to make sure that symptoms won't develop, even though sometimes, there are cases of asymptomatic transmission. So Vietnam was very rigid in that regard to prevent any possible, even undetectable at the time of screening spread. So it was rigorous. It was quarantine in the centrally administrative quarantine wards, so not self-isolating at home, where people are usually, it can be less disciplined and can go out or can get into contact with other people, neighbors. Vietnam is a very densely populated place. So if self-quarantine at home could further cause dangers for the others, so it was administrated centrally. So in that way, you can really have a control over those who are either affected or potentially affected by the virus.
Okay, Dr. Lee Tu, we're going to take a quick break, but we're going to ask you to stay on the line because we want to continue this conversation on Vietnam's response to the COVID-19 pandemic in just a few minutes. Stay tuned to Consider This. Hello, if you've just joined us, you're watching Consider This. I'm Melisa Idris, with me Sharaad Kuttan. We're speaking to Dr. Huong Lee Tu, Senior Analyst at the Australian Strategic Policy Institute in Australia. Dr. Lee Tu, now I want to talk a little bit about Vietnam's relationship with China, because not only is Vietnam's economy closely linked to China, but both countries are also geopolitical rivals in the South China Sea. and being neighbors, how is that relationship during this time of the pandemic? Could you elaborate for us?
Well, Vietnam has been experiencing a series of coercive activities in the South China Sea during and even before the pandemic, but some activities have resurfaced and intensified during this pandemic. We've had incidents at the sea in April where the Chinese chief allegedly were coercing the Vietnamese ships, and as a result, Vietnam has actually put a complaint to the UN body. So, and this year is Vietnam's ASEAN chair, so it is very important for Vietnam to play the role well. And the South China Sea and territorial dispute have been a very important issue on the regional agenda. But obviously, the pandemic has prevented many meetings, has delayed many meetings, as well as have made it more difficult for leaders to be fully concentrating on regional issues when they are fighting the pandemic. So some of the meetings have been put on the online platform, just as we do, and a lot of the agenda of discussion has moved to the issues of pandemic rather than traditional security threats, such as the maritime issues. Obviously, they're still being debated, but obviously there are other more pressing issues to be discussed.
Right, Dr. Litu, before we get into the ASEAN kind of regional mechanisms dealing with the pandemic that were actually enunciated by the Vietnamese Prime Minister, I think in the last ASEAN meeting that was held, what other levels of engagement are there with China? In Malaysia, Chinese doctors from Wuhan came and have had a look at our response and have shared their experiences. Are there those kinds of relationships, of levels of engagement between Vietnam and China over the COVID pandemic?
Well, Vietnam is, I guess, has engaged with China in through the framework of ASEAN, because China-ASEAN had met over the pandemic earlier this year, so Vietnam was a part of it. But I'm not aware of Chinese bilateral efforts similar to the ones in Malaysia.
Just to come back to the ASEAN, the regional response, again, that Vietnam is the chair of this year's ASEAN summit. Now, critics have actually, I guess, pointed out that ASEAN has been rather sluggish in developing a regional response to the pandemic. Is Vietnam likely to take the lead or to step back at this point in time as more countries approach a nation-first strategy in dealing with it?
Yes, so primarily there has been national response. Obviously, this is a pandemic that affects a region and the world broader, but it is an emergency, and emergency, as I mentioned before, the faster the better, and regional multilateral cooperation requires some coordination, so some extra time, which is not necessarily helpful in a quick and fast response. So at the time being, the ASEAN as a regional response is more of sharing information about the virus, sharing research, sharing best practices, how each countries are dealing with social distancing measures, when are they lifting up and how are they lifting up in gradual mode. So a lot of knowledge sharing. The ASEAN framework actually has had for a long time dialogues on pandemic and transmissible diseases. But when the COVID hit, it was in such a scale, I don't think any of the ASEAN member states had anticipated how big and how contagious it was. So I think they are reviewing the previous, measures in place, the best practices, the early warning systems, and information sharing. I think in the later stage, when we're talking about the economic recovery and the collective measures, how this region should proceed from here. As you know, this health crisis will spill over into an economic crisis.
Right,
for
Dr. Melisa,
everyone.
before we
So
get
I
into
think-
the economic crisis, can I just ask you if the conversation in Vietnam or the conversation that Vietnam wants to lead includes things like vaccines and equal access to vaccines across the region, the differing levels of affluence across the region, how does that affect access to healthcare when a vaccine is developed, for instance? Is that part of the conversation that Vietnam wants to champion?
Yes, for sure. I mean, Vietnam has been pushing for the online meetings to carry on rather than to wait until leaders can meet. So at least there are some frequent and even constant communications. As far as I know, there are WhatsApp groups for the ASEAN leaders to stay in touch every day if they need to. And also the issue of sharing test kits, sharing PPE, personal protective equipment, other medical issues before we get to the vaccine. It's a long, long time of the research and trials before we get to the vaccine. But at the moment, even not all countries have the capacity to conduct their own tests. For example, earlier on, Myanmar had to send their tests to Thailand, for example, and not all of the countries have sufficient laboratories to conduct tests. So we are still in the very early stage of reacting and responding to the virus before we can get to the vaccines. And obviously, a vaccine must be equally available for everyone, because the region will not be safe if everyone is not safe.
Can I come back very quickly to something you mentioned earlier? You touched very briefly on Vietnam's innovation with test kits. I was wondering whether you could share a little bit more about that.
Yes, that was a very interesting development from very early on. I think already I saw in February, March that Vietnam not only was successful in developing its own kits, testing kits, but it was able to export beyond the region and as well as far as to Europe. So it was quite interesting development. At the moment, Vietnam is both exporting the test kits as well as masks and other protective personal equipment, so very much medical supplies. Vietnam has consolidated a lot of efforts to develop the laboratories that are able to conduct tests. For example, earlier on there were only a handful. By April it was over 100 laboratories that were able to conduct tests. So it is quite an effort, not only in terms of containing physically and isolating people, but also measuring and being very adequate in identifying the cases. And that was one of the success stories why Vietnam had been able to contain the spread so well.
All right, we're going to take a quick break. More on Vietnam's response to the COVID-19 pandemic in just a few minutes. Stay tuned to Consider This. Thank you for staying with Sharaad and I on Consider This. Let's continue our conversation about Vietnam's COVID-19 response with Dr. Huong from the Australian Strategic Policy Institute. Now, let's touch on the economy. I'm wondering how the domestic economy in Vietnam has been impacted by this pandemic. And I can imagine tourism is only one of the many sectors of Vietnam's economy that has been hit hard by this.
Yes, it's still an unfolding crisis. We don't know yet the full scale of damage, because even now that Vietnam has gradually returned to the normal as it can be, it's still not fully open yet. It is gradual in that approach. So there are a lot of economic loss estimated at the moment, but there are a lot that will come in still because we don't understand the full scale of the damage. But as you said, Vietnam is also very much affected by the tourism. It's a big portion of its GDP. And also manufacturing, because Vietnam's biggest markets are all in the crisis. It's the EU, it's the US, it's Korea, Japan, that's just gone up to a recession, and also other ASEAN countries, as well as China. All the markets are affected, so it's not going to be an easy and quick by any means recovery. So Vietnam had to reinvent its manufacturing. Obviously, it also not only export because it also depends on the supply chain, the parts and materials to produce. So everything is going to be affected, and it will take quite a while to come back to the predicted growth. Already by now, the predictions are quite grim, not as bad as in many other neighboring countries, but equally grim.
Right, Dr. Lito, one of the questions, I understand that Vietnam has kind of a mixed economy, right? So there's private enterprise, but there's also a lot of state involvement in the economy. To what extent has the government, through policy measures, redirected the production of PPEs or pivoted the economy to respond to both domestic and international needs?
So there are a little bit of a silver lining in that overall green picture, but as I said, a lot of that is still in the prediction. There are, proactive measures and policies that the government is taking to mitigate and minimize the loss. So, for example, manufacturing masks and PPEs, as you mentioned, are taking over some of the manufacturing numbers, but I don't think will be very sufficient or, being able to replace those regular numbers and orders which have been in large scale cancelled or postponed by now. So there will be, as I said, it's minimizing, it's mitigating rather than replacing. But also there has been a trend that it had been happening before the virus came, which is the trade war. And because of trade war, a lot of factories, Western, especially American, had been considering Vietnam and moving out from China, for example, and moving to Vietnam. So I think the government is hoping that this trend will continue. And as we know that certain big corporations and multinationals such as Apple are already looking into expanding in Vietnam. So, if the great power competition and trade war continues amid this coronavirus crisis, Vietnam could see, new factories and new investments and also some shift from China to Vietnam.
Okay, so you mentioned earlier that the predictions for the economy is quite grim. This crisis is still unfolding. Has the Vietnam government announced economic stimulus like other countries around the region, and is that going to be enough?
Yes, it has announced already several times. At the moment, it's around 20-30 billion, if I remember correctly. So it's not looking too great in comparison to other countries. Even in it's not comparable to what Malaysia has announced, for example. So it's not going to be sufficient. Obviously, it is a challenge for every country, every economy, whether developed or developing. Here in Australia is also a case, but I don't think stimulus packages are sufficient to fill into that, upcoming big crisis. We don't know. I can only repeat some of the economists' predictions that it's going to be a global recession and it's going to last for a long time. Right. Already by now, we have some numbers confirming that the unemployment rate numbers are higher already than during the global financial crisis, which took such a longer time than this couple months only. So,
speaking of unemployment, Dr. Lito, sorry, we're running out of time. Just very quickly, I want to ask you about Vietnam's social safety net. And many people who've lost employment or are underemployed now severely. What kind of program has the government rolled out to protect those individuals, those citizens?
Well, there are program safety net, but you have to remember that there is a lot of people whose livelihood are based on informal economy. So even if the social safety net, which is not as good as in developed countries, especially like in Europe or more or higher in OECD countries, those who are not covered are also going to be affected, and that's really going to be a devastating effect for not only Vietnam but most of the countries in the region, because the dependence on informal economy is so big. We can't understand the full impact of that yet.
I see. All right, and in the last minute or so that we have left, Dr. Lithu, can I just get your thoughts on what's next for Vietnam? So it has, for all intents and purposes, successfully contained this pandemic, and the economy is now opening up. What is next to ensure that it remains on this right track?
Well, I think it's very important to stay vigilant. We don't know how many waves of the coronavirus will there be. It is very cautious in opening, in gradual and very rigorous in monitoring the development. It is slowly opening for domestic tourism, which will help boost the economy a little bit, and even opening some secondary borders in order to have the goods and materials for production and economic activities going on. But it will have to be very, very vigilant in monitoring the situation, because nowhere else, you can be sure that the virus is contained.
All right, thank you so much for speaking with us tonight, Dr. Lithu. That's all the time we have for you on this episode of Consider This. I'm Melisa Idris, with me Sharaad Kuttan, signing off for this evening. Thank you so much for watching, and good night.